Good evening, Sky Divas and Fly Guys. How's everyone doing? Hope everyone is great. I am seeing a lot of CJOs today. Congratulations. I'm so excited for you. Again, welcome. This is a wonderful company. I hope you enjoy it and love it as much as I do. Don't talk about my bonnet, but I have work, so I got to keep my hair rolled and stuff before I get ready for work. This video is going to be real quick. It is about our health benefit packet. And a lot of you guys are much younger than me, and for you, it may be the first time you're going to be getting your own insurance if you're not still on your parents' insurance, and you may not be familiar with insurance and how it works and what is what. Well, congratulations. Insurance is my field. That is what I worked in for over 26 years. So I can help you with your insurance questions once you get your insurance packet. If you have any questions, but I'm just going to go over the basics right now. So we offer at this moment United Healthcare. There are several plans for you to choose one, from an HMO. Those unfamiliar with an HMO, is a health maintenance organization. With an HMO is usually cheaper, in some cases free, for just the employee, meaning nothing comes out of your check if you choose an HMO. That is in some employers. I am not, at the top of my head, don't know if that's an option for us, but it is the cheapest one. And you have to have a primary care physician. You have to select one. So if you already have a doctor and you want to keep your same doctor, I would double check, if you choose that plan, that your doctor, which most of them do, take United Healthcare so that you can keep your same insurance. With an HMO, you have to select the primary care, which an abbreviation term is PCP. And you have to go to the doctor for all your treatment. And if you need to see a specialist like an OBGYN or urologist or something, any type of specialty, then your primary has to refer you to them. Most younger people choose HMOs because it is cheaper and you don't really go to the doctor that much. And all your preventive services, such as your annual exam, well, women's and stuff like that, are covered at a 100%. Now, with HMOs, you usually have a copay or something like that. So it just depends on your needs. If you are someone that goes to a doctor a lot because you have maybe some underlying issue that you take medication for, and you go, you have frequent doctor's visits, you may want to look into the PPO plan. A PPO is a preferred provider organization, and you can choose any doctor that you want to go see to, go to that accepts United Healthcare, and you don't need a referral to go see any specialists like a gastro, OBGYN, or dermatologist. You can go make your own appointments. They're usually more expensive depending on what plan you get, but some of them have very high deductibles, and they may cover 90/10. If you don't know what a deductible is, that means something that you have to pay out of your pocket annually before your insurance pays for any of your services. So for instance, an example, if you have a $3,000 deductible for the year, you have to pay as a patient $3,000 worth of services before the insurance company pays their 80% or their 20%. And you may even have an office visit copay, meaning when you go to the doctor, you may have to pay $20, $40, $30, whatever their copay is for that doctor. And then one of our other plans is an HSA account, which stands for Health Savings Account, and then a flexible spending account, FSA. Flexible spending account is they give you a debit card like a MasterCard. You select an amount you want to put on that card for the year. The money comes automatically on the card when it's mailed to you, and you use that card to pay for medical expenses. But they will deduct that amount out of your paychecks every time you get paid. So typically, if you start, say, the year off right, the first of the year, we have 26 pay periods. So if you decide I'm going to put $1,500 on my flexible spending account, you can kind of guess how much they're going to take out of your check. If you divide that 1,500 by 26, and that's you paying that money back that they gave you up front to pay for medical expenses. An HSA account, which is a health savings account, is money that you put into the account before you can use it, So they give you a card as well, but nothing is on it until you get paid. So like I have an HSA. I think I put $1,500 on it. So every paycheck, they take out $125 every paycheck that goes into my HSA account. And so when I go to the doctor, eye doctor, all my other doctor's visits, or anything medically related at the pharmacy, I can use that card to pay for it. And it's non-taxable. They don't tax that money. And it's for you to use for medical expenses, especially if you are like me and we are check to check. Well, I am. I don't know. I can't speak for you yet. And if you go to the doctor and they give you a prescription, and you may not have the money to go pay for that prescription right now, but you have your FSA or your HSA card, and you can use that money to pay for your medical services. My deductible was very high, but I've already met it for the year. So now my visits, I pay just 80%. I pay 20%, and the insurance company pays 80% of all my visits. So when you're selecting your insurance company, it's very important for you when they give you your book to review all the options, what they cover, what is covered, how much is the deductible, how much is the office visit copay, and how much is going to be coming out of your paycheck to have that insurance. If you're someone that never gets sick, maybe a cold, and you just go to the doctor for your annual checkups, then you don't need the most expensive plan. Just get the basic plan. If you're someone, like I said, like I have underlying health issues that I have to see a doctor for all the time, I chose a plan that works for me. I pay more money for it, but that's what I need at this time. And I have kids that are on my vision and my dental insurance, and so I spend a little bit more money on health insurance right now. Next year, when I redo my health insurance, I may not choose the same plan. You can switch it every year, but once you get it, it is yours. So don't be one of those people, and I have them in my family, who just get insurance and say, oh, I got health insurance. Don't know what it is, where they can go. And they'll call me saying, I went to the doctor and they told me that I had to come off of $1,000 before I can be seen. I'm like, okay, but do you have a deductible? What is that? Well, that is why. Because you have to pay that first before your insurance company will pay anything. And if, say for instance, you go to the doctor because you have a cold, that's considered a sick visit, right? So if that doctor's visit costs $150 and you have a $3,000 deductible, you are going to pay whatever the amount of that visit is for that day. If you go to the pharmacy and your prescription is $40 and you have a $3,000 deductible, you're going to pay $40 for the prescription because you have to meet your deductible first, right? If you've met that $3,000 and say you have to have a surgery done, right, and your insurance is going to cover $80, then you got to pay the 20% of that surgery. So you haven't met your deductible and it's $3,000 and you have to have the surgery that costs $5,000. You're going to pay $3,000. The insurance is going to pay the remaining $20,000. 80, and then you're going to pay the remaining 20% of that. You get it? So think about those things. If you choose a plan with a high deductible, get the flexible spending account card so that you can have that money if you need to. So it's all individual needs. So if you're the first time getting your own health insurance and have questions, please don't hesitate to ask. Those are things you're going to need to know. Contribute to a 401k, especially if you are young. I wish I had someone to teach me these things. I wish my mother knew those type of things, but she didn't. So I am speaking to you as if I'm speaking to my kids. If you get a job that has a 401k, whenever you're eligible for that 401k, contribute to your 401k, okay? The company will match it. If you plan on being in this career for a while and you're going to retire, you need to invest in a 401k. You need to start reading up on stock options and how to purchase stock and build a portfolio. I wish someone taught me these things. I'm still learning about stock. I've invested in a couple of stock. I'm trying to learn how to trade, but that's a different story. You need to get the 401k. You need to get the short-term or long-term disability. And that if something happens to you, you need to be off. You get sick, you have surgery, you have a family emergency, or something comes up, and you need that time off. You still want to be able to get paid for being at home. So you need to, invest in one of those. What else? Of course, the dental and the vision, that you should definitely get that. What else? I'm trying to think. Anything else? Just look over the benefits, but I advise investing in a 401k at your age right now and being very selective on your health insurance that you get. It is very important. You need to take care of yourself. You need to make sure that you are taking care of yourself and that you have what you need. And you don't want to be stuck with something and then you still can't go to the doctor because you can't afford to go, right? So once again, we have good insurance. You're going to have plenty of options to choose from as far as which plan you should choose. Choose the plan that works for you. Your classmate or your coworker may have different circumstances, so don't rely on them and say, I'm going to get what you get, because their circumstances may be a little different. You have to hone your medical benefits into your special needs, your special circumstances. If you have kids, are they going to be on your health insurance? My kids are covered under their father's medical, but I have them on my dental and my vision. We already talked about your flight benefits, but this is more important. Your health is more important. They have a really good health program with United Healthcare, a wellness program that would help you with like your weight loss goals. And then they give you cash back for doing certain things. So like if you go and you have an annual exam, a wellness exam, and you do your glucose and all that, it's called Rally Fitness if you sign up for it. I got a scale. They sent me a scale. They sent me, they have discounts on Fitbits. They sent me a food scale. And then for signing up for different things, they'll send you like gift cards, and you get to choose your gift cards that you want. I think last year I got like $600 worth of gift cards for participating in these health and wellness things. So when they go over benefits, that they really pay attention to those options is important, especially for you younger people. That is important, but don't dismiss the 401k, because I really don't have a 401k right now, and I've worked since I was 19, and had I invested or had I known, when I get ready to retire, if ever, I don't really have nothing, I'm investing now, but in the past when I've had other jobs and I would leave and then they would ask you to, or tell you or give you the option to transfer your 401k to another, roll it over into your new job's 401k. I was like, oh no, give me my money. And then they would, send me my check and I would just spend it. I didn't think about retirement. And now that I am 48 years old, damn near, if I had to retire, I don't have nothing. So the best advice that I can give you as a young person starting a new career is to invest in yourself and invest in your future, and start asking about stocks and investing in stocks and building a portfolio. And if you can actually learn to trade and get into trading or have an interest in trading, I know someone who teaches it that I could introduce you to or point you in the direction of her page, her Facebook page. I don't get anything from this at all. And I think she started teaching to like middle schoolers recently too. I'm actually going to sign my daughter up to take her class, but I wish someone would have taught me these things when I was younger. Ooh, the things I know now, if I knew then, I probably wouldn't be where I am today. So anyway, guys, good luck. Congrats again. And I hope this information was informative. If you have any other questions regarding the medical insurance, and if you don't understand some terminology, please don't hesitate to ask. Take care.